Hi guys, welcome to another video. Today I want to talk about the standards of practice and bladder for a PSW. Bladder care is helping a resident or a client with urinary elimination. So this might mean using incontinence products like briefs or pads. They might require catheters or bladder training. This is really private care, obviously, as all personal care is, and the person should be treated with dignity and respect. So if the person is unable to take themselves to the bathroom or change their incontinence products, they would require a PSW. So we might be just changing an underwear, we might be just changing a pad, we might be changing a brief, we might be emptying a catheter or changing a catheter. As a PSW, we are taught how to change a catheter in school. However, if we for some reason don't have that training, then a registered nurse or a practical nurse could show us how to do it. If you are having to be taught about how to change a catheter, make sure you know the importance of the sterile environment. You don't want to break the closed system and introducing bacteria. So PSWs are responsible for caring for external catheters. Nurses, etc. will be handling inserting them. And if a PSW has to be trained how to do it, make sure that it's documented in the RHPD. That's basically it for bladder care. Because it's so short, I'm going to include bowel care with it. Bowel care definitely is a little bit different. Basically the same premise of changing products like underwear, briefs, pads, but instead of a catheter, you might be dealing with a colostomy bag. Bowel care is helping a resident or a client with bowel elimination. They might have a bowel routine, which is a toileting routine. They may have continence issues, so they are unable to know when they have to go to the washroom. So obviously they'll be using continence products such as a brief. So if the person again cannot get to the washroom themselves or change the product themselves, they would require a PSW. So a PSW will help with the transfer to and from the toilet. We are responsible for changing their clothes, changing their product. A PSW can assist with a suppository or an enema. If a resident or a client is unable to do their own enema, a PSW can perform it, but only if they have been delegated. So to be properly delegated, you're going to have an RN and an RPN train you, and it will have to be documented also in the RHPA. A PSW also assists with ostomy care. So residents and clients can perform their own ostomy care, but for whatever reason, if they can't, a PSW can assist them with it. So there's a little stoma, which is the opening of the ostomy. That's where the surgery occurred, and that is where their bowel elimination occurs rather than where we have our bowel. A PSW can never insert a medication or an instrument beyond the opening of a stoma. You are doing external care. As a PSW, you were taught how to change an ostomy and clean it. Obviously, if you have not been trained for this, just like the catheter, you will have an RN and RPN train you, and it has to be documented in the RHPA. And make sure you know the importance of skin care, because bowel can cause a rash on the skin if it's there too long. It's really important to clean around the stoma. A lot of people forget to do that. If you don't, they're going to get skin breakdown, rash, like I said, and make sure they're using the proper bags and equipment when you're changing it. There's different sizes and everything. If you're doing an enema or a suppository, you have to be delegated. This is not something a PSW can regularly do. An RHPA, because I've mentioned that a couple times in this video, is the Regulated Health Professionals Act. So this is to ensure that the PSW has had the proper training by the RN or the RPN to do these tasks. PSWs have been trained how to put on the wafer that applies to keep the colostomy bag in place. So we can do that. However, if you haven't had training, ask your RPN, your RN to help show you. So that's basically all on bladder and bowel care. I hope this helps educate you a little bit. I'm going to be inserting pictures to hopefully help explain things further in this video. Yeah, I hope to see you guys in another video. Goodbye.